Now, the Ghana Health Service has for the first time published data backing claims that COVID-19 cases in this country have peaked and has actually been on a decline. Some public health experts have in the last 2 days challenged government position that the country has reached that peak. The country's case count jumped from nearly 400 in the latest reporting, one of the highest since the outbreak in Ghana. But at its briefing today, government mounted a spirited defense of its handling of the crisis. Here is Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje.
That's an increase of about 372 cases since the last updates. And this, as usual, covers all cases diagnosed since the first case was recorded. Out of this number, a slight increase of those recovered has moved to about 303 cases and 18 deaths. There has been no COVID-19 related deaths since the last update, which was 2 days ago. This number leaves us with a total number of 2,770 active cases. When we say active cases, what does it mean? It means that the number of people that we are actually currently following up, that is exclude those who are recovered and those who have died, and that gives us about 2,770. There are still a number of people who may have left the country, so there are lots to follow up, and people who are also not being being reached. In terms of the cases recorded since the last update, 248 had come from Greater Accra, and that came from 20 districts instead of the 24 districts that was recorded in the last update. We have mainly from Accra Metro, 48, Korle Klote, 41, Ablekuma South, Ashaman, 17. Ashaman has come down now. And this comes, as I said, 20 out of the 24 districts that reported cases in the last update. The rest of the country contributed about 124 new cases, and I'll share the details in the course of this presentation. Out of the total cases, the 3,091 cases identified, 944 has come from the routine surveillance, that is those presenting with symptoms at the various health facilities. At the last update, that number was 919. 2,032 have been identified through the enhanced contact tracing, and as usual, the quarantine cases still adds up about 115. For the types of presentation and case management, we have about 2,765, accounting for about 90% of those cases presented with asymptomatic, or they had some mild symptoms, and most of them are being managed at our at-home treatment centers and mainly at the isolation centers. (618) of this number had come from the routine surveillance, and as much as 2,032 has come from the enhanced contact tracing. The number of people who are moderately ill still remains at 5, and that has not increased since the last update. When it comes to the positivity rate, we have a positivity rate. 33,069 persons have been tested from the routine surveillance, and we have 944, giving it a positivity rate of 2.85%. The last presentation about 2.9%. 102,833 has come from the enhanced contact tracing, and out of these 2,032, as mentioned earlier, had been confirmed, leaving our positivity rate of about 1.98%. We have been looking at, we wish we were able to get cases every day and be able to report on the positivity, but we also have the opportunity to go back and take samples and to see where the day that the samples were taken, how many were positive, which actually gives us something similar to if we had done it in real time. If you look at that data, we peaked around the 27th of April this year. And since then, the numbers have continued to come down till the last presented, that was yesterday. So that is showing that of the positivity, since the peaking on the 27th of April, we have consistently recorded a decline until today. And we hope that will continue to be the case so that we'll be able to nip it, these cases, bring it under control, not actually control it. As I raised in my last press briefing, COVID is still not equivalent to death as people have perceived it. We want to encourage everybody to continue applying the protocols that we have done. We are also coming up with protocols that will guide people as to if you are a hairdresser, if you are a barber, what exactly should you do to protect yourself? We know that it's not as simple, so we have protocols which will be out, as we mentioned last time, and share with the various groups. We have already started engaging them to share with them.
That's Dr. Patrick Abuaje there. Well, Director of Public Health at the Ghana Health Service, Dr. Bedusa Kode, has also been defending Ghana's handling of the crisis so far.
And I mentioned the district that were created the main issues. Eastern region had one extra case, so they have a 95 now, as at 4th May, and that came from one of our hospitals in the Eastern region from routine surveillance. The Central region has had 2 new cases. 7 were from Infansiman district, and 2 from Swedru and Cape Coast, and 1 from Moree. The Western region has had 10 more cases. The last presentation was 21, there are 31, and the cases are reported from our Hunter West, cases from St. Martin de Porres Hospital, Ekwe, among others. And they are all mainly routine surveillance. Volta region did not add any more, it still remained 30 from the last update. Ashanti region added about 41 cases, new cases, some from Enhanced and some from routine surveillance. Kwabri East showed the largest number, 20, with Achuma Kwame adding 5 to the rest. Upper East has 7 new cases as of the last briefing. The case from Bolgatanga municipality. Northern region has not had any increases, remain 13. Northeast still 2 cases. OT has still 23 cases, no increase after the last count. Western North has had some circumscribed outbreak, and so they moved from 54 to 56, having an increase of about 52 in Western North. This comes from a circumscribed area of a group of workers where we've had this number coming from. Greater Accra, as mentioned, had an increase of 248.
So this is a conversation we had extensively here on the show yesterday, trying to understand the peak and how it works and whether it even matters in the first place. Well, let's take a look at, you've had government's position with the data it is using to back that particular position. Let's take a look at the case count today as it stands on the Ghana Health Service platform. Biggest, we're well over 3,000 at the moment. We're working that up to bring it to you. I also love to hear from you wherever you are. There are about 4 regions that have not recorded any cases so far. So there you have it, 3,091. Those are the total confirmed cases as of now, 3,091. Like you said, like you heard government say, we've actually been peaking, they say, since the 25th of April. Let's take a look at the regional breakdown. Greater Accra continues to lead with 2,579. You saw the figures for Ashanti region as well. The Central region, we're having some updates on that. 50 cases so far. Western region has 32. The Volta region has 30, and the Upper East region also has 30. Now, OT region has 23, the Upper West 19, Northern region 13, Northeast 2, and so far, Bono has now, I beg your pardon, reported 1 case. 18 people have died, but we're also seeing a surge in the number of recoveries. 303 people have recovered so far. Share your thoughts with me. Where do you live? Where are you? What are people doing around you? Do these conversations about peaking, not peaking, even matter to you? Why do you think it matters? And what are you taking from government's description of the situation? Now, government has also been speaking on the stimulus packages that are supposed to support struggling businesses. Now, lots of businesses have complained about their inability to pay their staff and the bleak future they see ahead. Listen.
In the past few weeks, we have led a few engagements to come up with a product, and those products are aligned with what the people, the micro, small, and medium enterprises need to be able to go through this very tough time. This has also been supported by the Ministry of Finance and his team, as well as the National Board for Small-Scale Industries, ensuring that at the end of the day, when this program is rolled out, everything goes along very efficiently and is transparent for us all to be able to access. With that, we've also come up and worked very closely with the various stakeholders to come up with the eligibility criteria and really tighten it in such a way that it allows for people to have the option and be able to apply for the facility. Exclusively, we've also been able to communicate to everyone, especially the associations, trade groups, and the financial institutions, so that they align, so that when the program is rolled out, we'll be able to support and assist. In order to make this more efficient and transparent, the team as well as the board decided to work on a technology portal where applications can be processed and where applications would go to. We are also considering, and with engagements that we've had in the past weeks, to align very closely with those who might not have access to technology in some of the districts across the country, so that we do not exclude anybody from accessing and to apply for this facility. So in the past few weeks, we've been working on this portal as well to ensure that it is the right one for our board to approve, as well as to make it more efficient. Currently, we are stress testing the portal to ensure that on the day when it is launched, when there's a rush or when there are a lot of people, it does not disappoint any of us. And so currently, in the past few weeks, as I've mentioned, we've been working on coming up with the right product to support the micro, small, and medium enterprises, not forgetting the informal, but also considering the formal as well. We've been working on the portal where the applications will come through to ensure that there's accessibility for the nation, not selected people, and it would also be transparent and efficient for us to be able to get our funding. And we believe that in a few weeks, once the stress test is done, we will continue in the coming weeks to engage with various stakeholders so that they can start educating the population, and we'll start the communication as well so that more people know about it and can apply for it to avoid future challenges where people are not able to hear much about what we have to offer that the President had announced as part of the 600 million cedi stimulus.
Do you own any business that's struggling at the moment? Does this settle it for you? Do you have you even tried to assess this process? How did it go for you? I'd also love to hear from you. Let me read for you some few messages that I've had. This one says, nobody can deny the fact that Ghana has reached its peak in terms of COVID-19. I believe in our health experts and our health system. Let us keep to the protocols. This is coming from Divine Afidemenyo in Pando. Divine, thanks for sharing with us your thoughts. Farouk is texting out from Tamale North. Farouk says government must provide free medical care for COVID-19 victims. I think at the moment that's what's happening. COVID-19 victims are being taken care of by the state. Thomas from Nalerugu says, JoyNews, could you find out from the authorities of power supply in Nalerugu and its environs, and if it's because of the 50% waiver government gave to all customers, they should stop it and restore power supply. We are tired of the frequent power outages. Certainly. Every one of us have our own problems. So these are some of the thoughts you're sharing with me so far. I'm going to take a very quick break. I'll return shortly. When I come, I'll be talking to someone from the Department of Sciences and Natural Studies. We'll find out a bit more about Ghana's situation at the moment. Do stay with us. So let's try and have a bit of a conversation, try and analyze it if we can, of the trend. Government says we are at the peak actually, and actually declining. We have also been given data from government to support that claim. Dr. Emmanuel de Graaf Johnson is a lecturer at the Department of Statistics and Actuarial Sciences at KNUST. He's joining me via Zoom. Dr. de Graaf Johnson, thank you so much for joining us this afternoon.
Thank you.
All right. So I'm assuming that you've seen the figures, the data that government provided today, the graphs. Have you seen them?
Yeah.
Very well. So let's take it one after the other. Let's look at what we have on the screen at the moment. That gives us the distribution of COVID-19 cases in Ghana by date. The sample taken between March and May 20. When you look at this particular graph, what does it communicate to you?
If you look at the graph from March up to date, you can see that there is some form of decline that is going on. If you look at the right tail has been very impeded. That means that we are consistently having a stable number there, which is reducing to the right in May.
Okay. And if you compare this particular graph to the actual figures as we know it and as presented on the website of Ghana Health Service, to what extent does it make sense? How can you break it down for those of us who are not experts to understand the situation?
Okay. Now, if you look at this one, he has date samples were taken.
Yeah.
That is the data of date samples were taken. Okay. And these samples were taken, how many of them were tested positive, as you have it here. So here, you can see that as the date goes by, there was some kind of increasing up to a point, which is actually somewhere April up to this May,
yes,
and it begins to decrease.
So
when
is that
the internet, the data that you have there is cumulative. Okay. Cumulative means that it's going to add up anytime. Now, it's very important for us to put that kind of distinction between them. For the fact that you have what we call turning the curve does not mean that your cases is going to decrease, because it is cumulative. Even if you consistently have lower numbers, it's going to add up the number that you are going to have. So the number that we're going to have on the internet, the one at the Ghana Health Services online or website, is cumulative, and that number will go on. Okay. It is also very important for us to differentiate that if you have a turning point today, it does not mean your confirmed case will not increase, because turning points today are people who have been tested positive. In few days to come, that is the lag time, some are going to develop into symptomatic. So even those who were unable to be detected in the samples, they are going to develop symptoms, and they will come and add up to that. So if you're looking at this data that the director of Ghana Health Services have given it out, then it gives much more to appreciate what you're doing.
Okay.
What we have to do is to use this kind of the daily incidence data that he has shown here to put into our models and then confirm what he is talking about. But if you look at the graph that he has provided for the day samples were taken and the number of positive recorded, he is in the decline form.
Okay, so as far as the data is concerned, it indicates that there is a decline. But for someone who is into statistics, usually we look at the statistics to make sense of the non-statistical data, right? And we do that because we actually want to understand the trend to make it relevant for our lives. Is this discussion that's been going on for, say, 2 weeks now even relevant in the first place based on what we are dealing with at the moment?
The whole thing has to deal with data management. That is the whole discussion has been. Because when pandemic happens, what happens is that people look for answers, and people look for answers from our leaders. So if the answers that is given by our leaders if people around seems that they are not entirely happy with that because it was coming after certain days, it will lead to some people to raise questions. That is the reason why Professor Kusa raised that question. And we do understand after that, government, they've been doing very well, meeting other organizations to try that they give out better data. And if they give out better data, most of these ones will be answered. So in the first place, there was no need for us to give data in a manner that will raise questions. That is the whole thing. So once you have live data, people want to know, if I'm under lockdown, I want to know the next day how many cases, the following day how many cases. But if I have few days without any report and then the next day, bam, a big number, it gives people much to worry. That is the reason why this one happens. By looking at the data that director has shown right now, I think if they consistently continue to do this and give us daily incidence data relation to each day samples, then we will all be in a better place to model this and give insight into the data.
So daily incident data would help us. I just want to be clear that I understood you properly earlier when you said that the figures will go up. I'm saying this because one of the key questions people have asked is, they'll say, why do you say we are declining when every day we're seeing an increase? So today we are at 3,091 cases from the 2000s. So people ask the questions, if we are going up in figures, then we're certainly not declining. But from the explanation you give, you say that the number is cumulative. So what you have will by all means increase. But the rate at which it increases, what gives you the indication of the peak. Did I get you correct?
Yeah. As an expert, what I look for, it is not the cumulative number of cases that they will announce. I will look for how many incidence cases do you have today? How many do you have tomorrow? How many do you have the next day? How many are still active cases? Because if somebody died today, his case is still part of the cumulative cases. If somebody recovers today, his case is still part of the cumulative data. So for us to know where we are, it is only the active one that I'm interested in, because some people have recovered, some people have, unfortunately, they've passed away. So if government continues to give me data of how many people are attracting or contracting the disease each day, if this number keeps on dwelling down as the days goes by, then I'm very confident that our measures are working. But if I don't have that, then I have only the cumulative. Even if you have 2 today, tomorrow 1, the next day 1, it will still add up to be cumulative. Cumulative is never going to decrease. As far as pandemic measurements are concerned, cumulative numbers are not going to increase. But incidence data are the data that rises up and decrease. That is what tells us where we are. So given the data that he has or he has presented today, it gives us much more information of where we are.
Doc, I'll say a very big thanks for joining us all the way from Kumasi. Dr. Emmanuel DeGraff Johnson is a lecturer at KNUST there who joined us via Zoom to help us understand the data. Is it even important? He says it is indeed important because it answers questions on people's mind and brings you a sense of assurance that government is doing what is right, as we even focus on dealing with this particular problem.